So as of yesterday, our practice went into what's called Total Triage. I know many practices have been doing it up and down the country for months or years, especially since COVID. But this is the first time that our practice has gone into this phase of Total Triage. But what does Total Triage mean? So from now on, if you want to contact the practice, you have to do this online or on the telephone. And it doesn't matter what the request is. It could be something to do with symptoms, it could be medications, it could be referrals, admin kind of a query, sick notes, for example. And every query will be looked at by a GP or an advanced nurse practitioner. And then that clinician can decide on, number one, do they need to be seen on the day? If they do, where can we put them? Who do we put them with? Is this appropriate for the physio? Is this appropriate for the nurse? Is it appropriate for a doctor? And also the urgency, they can decide on that too. Also, for example, if you needed your sick note extended, but you don't need an appointment necessarily, then they can do that and send it to you via the text messaging system. And that would all be done on the day. There are going to be some situations whereby that patient doesn't need to be seen on that day. So then that doctor or clinician will send a task to reception, who will then contact the patient and book them in for the next available appointment for that issue. For example, if it's a smear or if it's a asthma review or a COPD review. And having worked in a Total Triage practice before, I do think it works well. I know there are some concerns from the BMA about GPs being overworked. Having said that, we've been overworked for years. It is a different way of working, and I'm sure the more we do this, the more we'll realise how to make it better. But I do find that this Total Triage system does give the GPs, the clinicians, a lot more control as to how the appointment system is managed. Because obviously receptionists are not medically trained, and sometimes patients are booked in with clinicians or healthcare professionals that may not be able to deal with that. Or maybe that person could have been better seen by, the physio, for example, if it was a knee pain or a shoulder pain. And yeah, if I do see someone with a shoulder pain or a knee pain, I'm not going to turn them away, and I will treat them, but I'm going to probably refer them to physio anyway. So it's more about trying to cut the middleman out and do the appropriate thing as fast as possible. And if you can't do it online, you can ring the practice, and the reception staff at our practice are able to fill out these kind of triage forms for you on your behalf. It will be interesting to see how this all pans out. And I'm sure there are people who are going to have some kind of issue with it. There's not a perfect system for anything really at the moment, but we are all trying our very best to provide the best service we can. Please put in the comments if you've had any experience of the Total Triage and what your thoughts are about it. Thank you.